Did you know your body has about 50 hormones and you can experience hormonal imbalance at some point? Today on the program, we are taking a look at what exactly are hormones and what causes hormonal imbalance. Good evening, I am Olasumbo Modupe, and thanks for always joining us on Lagos Television. The program is Sound Health. The conversation begins after this break. Please stay tuned.
New data from the World Health Organization reveals that nearly 1/3 of adults are not active enough. That's 1.8 billion people missing out on the many physical and mental health benefits regular physical activity offers. Globally, women are less likely to be active than men. In some countries, this difference reaches 20 percentage points, highlighting a significant gender gap. Although physical activity is key for healthy aging, inactivity rises sharply after the age of 60 for people almost everywhere. By 2030, it is estimated that global levels of inactivity could rise to 35%. These new findings are a wake-up call. This WHO report has a clear message. We need to get moving to help more people be more active. This will require governments and stakeholders across sectors to partner to implement policies and programs, particularly to engage more women and older adults, to provide more support for innovation and local solutions, and to better align resources with policy commitments. Whether it's walking, cycling, dancing, or playing sports, regular physical activity is good for everyone. Let's all work together to get the world moving.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Fatai Tijani, consultant obstetrician and gynecologist, and he is going to tell us what are hormones and what causes hormonal imbalance. Good evening, Dr. Tijani, and thanks for joining us.
Good evening to the crew. It's good to be with you.
Thank you so much for finding time to join us on the program. So tell us, what exactly are hormones? I know scientists say there are at least 50 hormones in our bodies. Tell us, what exactly are hormones?
Yes, hormones are chemical substances, or we can say chemical messengers, that are produced from a gland from one part of the body to perform another function, sending signal to another body or tissue to carry out a particular function or different functions in the body. And we have different types performing different functions in the body.
Okay.
For example, we have the growth hormone that regulates the growth. So when there is too much, that's when we have people that are too tall. And if they are deficits, we may have some people that are too short. Using just there are terminologies for them in medicine, but because I'm not speaking to a medical audience, I will try and calm down. Then we have the sex hormones. That's another group of hormones that regulate the sexual function in a woman or a man in terms of pregnancy, menstruation. So we have some that are for men, which regulate their testicular function and their masculine. So if there is deficit or too much, they have their own effects. We also have other ones that regulate the temperature, the blood pressure, the glucose in the body. So if there is too much or too low, that's when we might have diabetes mellitus in some patients. So it means that there's a deficit. Sometimes there might be deficit, sometimes there might be excess in regulating the different functions of the body. I think by and large, as I said, we have different types, more than 50, and they have different functions. They are being produced by different body organs, different tissue, and sending signal to another organ or another tissue, and carrying out all these activities I mentioned.
All right, Dr. Tijani, thanks for that explanation.
Yes.
We have at least 50 of them. What are the most important hormones, and at what point do they become imbalanced?
Well, they are all important. It depends on the pathology we are looking at or the illness we are looking at. They are all important to regulate our well-being and our survival. But as gynecologists, I want to be tilted more to the sex hormones, which affect women. As I said, they are all important. It depends on your specialization. If another specialist want to speak on, it will just concentrate on the one that affects his own specialization, and they will, like, for example, if an endocrinologist want to hammer on hormones now, they might be talking about thyroid hormones, we're talking about the ones that regulate sugar level, sugar metabolism. But as a gynecologist, as I said, I might want to be tilted more to the sex hormones, the ones that affect women or girl child in terms of their regulations of their menstrual period, getting pregnant, sustaining the pregnancy to term. Because if these hormones are not well coordinated and balanced, we might have cases of some women not even starting their menstruation in the first place. And when it is time for them to start their menses, they will not start. And some will start, and it will be irregular, skipping months, not coming the way it should come. There are some categories that it is infertility, just because some hormones are not balanced. Maybe there is high prolactin, for example, they might not be able to ovulate, or if there is deficit in the follicle stimulating hormone or luteinizing hormone, there might not be signal to the ovaries. So these women will not ovulate because there is no signal from the brain. As I said, the signal will be sent from the brain through the bloodstream to the ovaries that, okay, you can ovulate. But if those things are lacking or lagging, there is no how the woman will menstruate. And we also have some instances where we have miscarriages. It may be some hormonal problem too. Okay, the woman is pregnant now, but she's unable to carry the pregnancy to 9 months. So, and as I said, it comes in different manifestations, but being a gynecologist, I will be tilted more to the sex hormones.
Okay, Dr. Tijani, why do we have, or why will a person experience imbalances? What causes this condition in these people?
Well, yes, there are different causes of this problem, of this hormonal problem. There are even some that are genetical, right from the womb. There is something we call, quote and unquote, factory error. When the baby is developing inside, then there is a miscalculation somewhere, and some glands are not just formed. Because we have seen women born without uterus, that is womb. We've seen some born without ovaries, some without vagina. So when you have cases like that, or we have a tumor somewhere in the brain that is disturbing the production, because some of these hormones, especially the sex hormones, are produced by the pituitary gland. It's a gland that is located somewhere in the brain. So if there's anything disturbing that brain or activities with that brain, there won't be signal, there won't be production of that hormone. So for those that have the congenital problem, they are just born like that. And when it is time for them to develop the female sexual characteristic, like development of the breast, development of the pubic hair, those things will not manifest because those hormones are not just there from birth. Then in our day-to-day activities too, we have seen cases of, as I mentioned before, the tumor, maybe there is a mass or so, tumor in the brain affecting the pituitary hormone. These hormones can now be overworking, producing more than necessary of these hormones, or not producing at all. So either way, they have their own problems too. When it comes to human reproduction, pregnancy, sexual function, menstruation, pregnancy, and the likes. We also have the stress factor, though that one is not in the forefront. Sometimes when you are stressed as a woman, the brain will perceive it as a not welcoming situation and they will not function. So those hormones from the brain, because it's a stressful situation, they will not function. And that will also affect how the woman will menstruate, how she will get pregnant, and the likes like that. So we have some other problems of drugs, unprescribed drugs by non-doctors or non-health people, and people who take different kinds of herbal concussion, unprescribed medication, over-the-counter medication to correct one thing or the other. Even the drugs can alter the hormonal milieu, the hormonal environment. Especially when you are taking some of these hormones that also has hormonal components, and you misuse them or overuse them, they will alter what you have normally in your body. So you can see the drug abuse thing, you can see the congenital part, you can see the brain parts. Then, more importantly, the age in a woman. For those that are above a particular age, and that is why we have menopause. When we have menopause, it means those hormones are gone. They're in low quantity, so they cannot manifest again. So you can see how age comes into the play. And there are some women at a particular age, usually greater than 35 years, there will be difficulty in getting pregnant just because those hormones are not optimal again. So they might need assisted reproduction or to assist them with some exogenous hormones. When I say exogenous now, you are not relying on the one that is in their body. You are giving them an outside drug to help them regulate this problem. So those are just few of the causes that we have because of time.
Okay, I'm glad you were able to differentiate the causes now. Let us look at the manifestation. What are the signs to look out for? Do we have to wait till we begin to feel that, okay, there is a problem somewhere?
Now, if you see a girl child that is in her 12, 13, 14 years, 15, and she's not menstruating, that it needs to be concerned. Why is she not menstruating at that particular age? Or you see a girl child that is around that same age and she's not having this secondary sexual characteristic that we're expecting that age. Maybe the development of breast, development of pubic hair, we should be concerned. You don't have to wait than she's 20. From that early age, when that age group ladies or girls are having that characteristic, she's not having them, then there is need for concern. Now, also a woman that is married and they have been trying to get pregnant for more than a year, and she's not getting pregnant, that there should be concern. It means there's a problem somewhere. It might be a hormonal problem or other causes, but hormonal problem should not be overlooked, and she has to be investigated. Also, a woman that is not menstruating regularly, she will menstruate this month, she will not menstruate in the next 2 months. Sometimes the menses will be too heavy or too low in terms of the blood volume or the duration. There's also a concern. So all these things, they are just being caused most time by this hormonal imbalance. So those are some of the manifestations. Or when you have a woman that stopped menstruation and suddenly she's in her menopause, suddenly she starts menstruating, seeing blood again. Now that woman needs to be investigated. Aside from the hormonal causes, there might be some other dangerous causes like cervical cancer and the likes. So those are some of the things you see that want to make you want to know that there's a problem and you want to look into it by visiting the hospital, by visiting a gynecologist to look at it and solve the problem as soon as possible.
All right. Apart from cancer that you just mentioned, infertility in women, are there other possible complications or complications now, health conditions the hormonal imbalance can impact or can bring about?
Yes, as I said, it's just an hormonal thing, and aside from what is outside what I've mentioned as a gynecologist, there are other things like what if you have a thyroid dysfunction now? A thyroid is an hormone, and if it is too low or too high, a woman might not even get pregnant. And her menses too might not be regular. You can see how hormone also came in. Then we are looking at prolactin. prolactin is produced by the gland that will send signal to the breast is in the brain. And if the woman is lactating when she's not pregnant, there is a problem. It means that she's seeing breast milk, she's not pregnant, or she doesn't just have a baby. There is a manifestation too that something is wrong. And that one will also disturb her getting pregnant or affecting her menses. So for other aspects too, the BP type, a woman that also have abnormal thyroid function test might be having high blood pressure, and we'll be looking at what is causing this. You know, because these hormones, if they are too high, for example, they will increase the metabolic activity of the body. And so, as I said, that all these hormones are important. No one is not important, and they perform different functions in the body. For example, progesterone. If progesterone is low in a woman, she will not ovulate. Once she's not ovulating, there's no way she will get pregnant. And if she's not even ovulating, her menses might not be regular. And there's this polycystic ovarian syndrome, COS. It can even affect teenage girls. You know, they will start skipping their menses. Their menses will not be regular, or they'll be having heavy flow as early as that age. It's part of the hormonal problem syndrome, hormonal problem. So all these things can be corrected by identifying the problem, where this hormonal problem is coming from, and giving the appropriate treatment. Just like infertility too, which is a very broad topic of its own, and we have a lot of high percentage of women saying open on God, but if they don't visit the health facility, there's no way they will know what the problem is. It's not about just believing in God. We need to take a step further by visiting a gynecologist. If it's an hormonal problem, it will be known. If it's a sperm problem, it will be known. If it's a fallopian tube problem, it will be resolved, and everything will be resolved. So that's some of just manifestation, depending on which hormone we're talking about. Though there are 50. So if you want to go one by one, we won't be able to.
Okay, Dr. Tijani, before I let you go now, you mentioned that a girl child is supposed to start menstruating at a particular age. For our viewers at home that are not enlightened about this factor that you just mentioned or pointed out, what is the exact age for a girl child to start menstruating, and what is also the exact age for a woman to encounter or experience menopause, so we can actually look out for these pointers in our lives?
Well, there is no fixed age that applies to everybody. And that is why we have different women having their menopause at different age. There are some people that will have their menopause as early as in their 40s. But our concern is if the menses is coming less than 40 years, we are concerned. For some people, it is 48 years. For some people, it is in their 50s. But usually we want to look at maybe 48 to 52 years averagely. But there is usually some people outside that bracket. The same thing applies to the menses. In developed countries where we have the girls that are bigger, they might start their menses earlier than in this part of the world, because the body size also matters, the diet also matters. So, but in our environment, we are looking at 14, 15. If by 16 the girl is not menstruating, we are concerned. And as I say, there is usually an average, but it can vary depending on the person. Same thing for menses and same thing for menopause.
All right, your call to action as we round up now, Dr. Tijani, your final words to viewers at home, especially the female gender now and the caregivers of parents.
Yes, so the female gender is just to be observant with our girl child. We should know when and what we should expect at what age. If we are not getting those things, or we are not seeing those things, a girl child, as I said, that is not menstruating, she's 16, 17, 18, she's not menstruating, it's not normal. At that age, no breast, nothing, it's not normal. We need to look at it. Or to start menstruating at the early age, at the right age, but she's having skipping of menses. She will menstruate, the next one will be 4 months' time. Or anytime she menstruates, it is high flow that will cause another problem, dizziness, fainting attack. Then it's just appropriate for us to visit a gynecologist today to identify what the problem is. And if there is now other hormonal component that is outside the scope of the gynecologist, will be in the best appropriate and the best position to refer to his colleague or a colleague that are in other specialization that handle those other hormonal problems that is under his purview. So the baseline is identify this problem and visit the hospital as soon as possible.
Hormones vary in people. Hormonal imbalance also vary in people. Do not judge your developmental challenges or changes with using another person's. Dr. Fatai Tijani, consultant obstetrician and gynecologist, thank you so much for your time and expertise on hormonal imbalance in women.
Thank you for having me. Thank you.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. Well, this is why we say thank you on today's episode of Sound Health. I'm glad you now know what are hormones and what causes hormonal imbalance. Hormonal imbalance or hormones are crucial to your health. Hormonal imbalance can lead to other medical conditions. So you need to see a medical practitioner early enough when you see the signs and symptoms cited by Dr. Tijani. If you have comments or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.